Imagine watching your child grow but noticing they don't respond their name. They avoid eye contact or engage in repetitive behaviors. These early signs can be concerning, but understanding them is the first step towards support. I'm Dr. Batista, a psychiatrist, and today let's explore what autism truly means. What is autism spectrum disorder? That is a neurodevelopmental condition characterized by challenges in social interaction, communication, in the presence of repetitive behaviors or restricted interest. We call it a spectrum because autism is not just a single condition, it's a group of related neurodevelopmental disorders that share core characteristics such as challenges in social communication and restricted or repetitive behaviors, but they vary widely in severity, also in the presentation. Some individuals may need substantial support in daily life, while others live independently and have unique strengths. Using the term spectrum help us recognize the full range of abilities, challenges, and support needs across different individuals. Let me explain you briefly what the criteria are for this condition. The first thing is persistent deficit in social communication and social interaction. This one have a lot of components. One of them is the deficit in social emotional reciprocity. This means the child may struggle with back and forth interactions. They might not initiate conversation, respond to social cues, or share emotions and interests. For example, they may not greet others, show little interest in playing with peers, or not respond when someone tries to engage with them. Another component in this criteria is deficit in nonverbal communicative behaviors used for social interactions. In this part, the children may have difficulty using or understanding body language, eye contact, facial expressions, and gestures. They might avoid eye contact, not using gestures like pointing or waving, or have facial expression that don't match with the situation. The other component, deficit in developing, maintaining, and understanding relationships. This involve challenges in making friends, adjusting behaviors to suit different social contexts. For instance, a child might prefer solitary activities, not engage in imaginative play, or have trouble understanding others' perspective. The second criteria is restricted repetitive patterns of behavior, interests, or activities. In this one, the components is a stereotype or repetitive motor movement, use of objects, or speech. This includes behavior like hand flapping, rocking, spinning objects, lining up toys, repeating phrases, or using language in unusual ways. The other components is insisting of sameness, inflexible adherence to routines, or ritualized pattern. Children may become distressed with changes in the routine, insisting in following the same route, or they might eat the same food daily, or react strongly to minor change in the environment. Other components, highly restricted, fixated interest. They might have intense interest or specific objects or toys, focusing only trains or memorizing information about that certain object. Other is hypo or hyperreactive to sensory input. This refers to unusual response to sensory stimuli, for example, to lights, sounds, or seek out sensory experiences like spinning or touching certain textures. Another criteria is the symptoms might be present in early developmental period. When I say that the symptom must be present in the early developmental period, we are usually talking about the first few years of life, from birth up to around 3 to 5 years old. But does not mean the diagnosis has to be made during that time. What it means, the signs were there, but they were fully recognized or understood even until later. For example, a child might not get diagnosed until age 7 or 8, but when you look back, the parents might remember that since infancy, avoiding eye contacts, didn't respond to their name, have delays in learning to speak. Those early signs are important to make the diagnosis. These symptoms can cause significant impairment in many areas of functions. Of course, this cannot be related or explained by intellectual disability or global developmental delay. Also, the classification to assess this condition consider the severity levels. For example, the level 1 is requiring support. However, the level 2 requires substantial support, and the level 3 require very substantial support. Early diagnosis is crucial for timely intervention. While there is no cure for autism, many treatments can improve functioning. For example, behavioral therapy is widely used to enhance communication, reduce problematic behaviors. Speech and occupational therapies. These therapies address language skills and daily living activities. The parent training programs is really important. It's just to support for the parents the child's development effectively. And educational interventions are essential just to meet the individual needs. Medications may be prescribed to manage specific symptoms. For irritability, that is common in those kids, we prescribe risperidone and aripiprazole that was approved for the treatment of this symptom in children. The hyperactivity and attention issues, stimulant medications may be considered. For anxiety and depressions, antidepressants or anti-anxiety medication can be beneficial. Understanding these conditions is the first step toward support and acceptance. While autism is a lifelong condition, early intervention can truly make a huge difference. Every child on the spectrum has unique strengths, even if they don't always express them in typical ways. As a parent, your love, patience, and advocacy are powerful forces. You are not just shaping your child's future, you are helping them find their voice and their place in the world. It may not always be easy, but is meaningful. Remember, progress may look different for every child, but with support and understanding, they can really come better in the future. Remember, you are not alone. Thank you.